Good day, ladies and gentlemen. Welcome to Kalusugan ay Karapatan. I am Padilla, and today our program will focus on teenage pregnancy. Did you know that 1 out of 10 young Filipino women aged 15 to 19 has begun childbearing? According to the results of the 2013 National Demographic and Health Survey, 8% of teenagers are already mothers, and another 2% are pregnant with their first child. The Philippine Statistics Authority also found that among young adult women aged 20 to 24, 43% are already mothers and 4% are pregnant with their first child. Isn't this alarming?
Yes, it is indeed very alarming, Dr. Menchit. But before I dig into the discussion, allow me to introduce myself. My name is ABDEL DISANGCOPAN, and good day to everyone viewing Kalusugan ay Karapatan. You know, Dr. Menchit, the PSA, or the former National Statistics Office, has also found out in its study that early pregnancy and motherhood varies by 3 factors: education, wealth, and region. It is more common among young adults, women aged 15 to 24, who are less educated than among those with higher education. Early childbearing is also more common in 2 regions, specifically Caraga, 38%, and Cagayan Valley, at 37%, than other regions. So the proportion of young adult women who have begun childbearing is higher among those classified as belonging to poor households than those in wealthier households. That is 37% for young women in the lowest wealth quintile versus 13% for women in the highest wealth quintile.
Wow, that's really alarming, Attorney Abdel, and we need to understand this better. And it is good that we have resource persons who can give us insights in the teenage pregnancy phenomenon. Let me start with Dr. Vanessa TICZON. She is a pediatrician who specializes in adolescents 10 to 19 years old. She is also called an adolescent medicine specialist. Thank you and for coming. Welcome, Dr. TICZON. We also have Dr. Valerie GUINTO. She's an obstetrician who specializes in maternal fetal medicine and or what we know as perinatology. Welcome to the program, Dr. Valerie.
And Dr. Menchit, to our right, I have here Ms. BADETTE ALBINO, who is a social worker from the Philippine General Hospital. We are thankful that all of our guests have agreed to join us today. And allow me, Dr. Menchit, to shoot the first question to Dr. Vanessa. The question is, what is teenage pregnancy?
Teenage pregnancy is the condition of bearing a child among women less than 20 years old.
After 20 years old, they go to another physician, the obstetrician, not necessarily the pediatrician.
Yes, ma'am.
So this time, let me address now Dr. Guinto. So why do we need a special physician, a special pediatrician, special obstetrician to handle the teen mom? Dr. Valerie.
Yeah. Thank you for that question, Dr. Menchit. Our teen moms are more at risk with a lot of high-risk conditions. First of all, since they're still developing, they do not know how to take care of themselves, they have this different diet or misconceptions on diet, a lot of them are anemic. And then therefore, they end up with small babies. And then since they do not have that much access to healthcare because they do not have that resources to go to the doctor, and they lack education also, then a lot of them end up with perinatal mortality. So that means that stillbirth or neonatal death. And also, because of their age group, they're also more at risk for preterm delivery and preeclampsia. Preeclampsia is high risk in pregnancy.
So what you're saying now is since the children are less than 20, they're 10 to 19 years old, these are patients who are still seeing a pediatrician, and that's why they probably are children. They're patients of pediatricians now. Is that correct, Dr. Van?
Yes, Ma'am Menchit. So they're primarily still children, but they're already bearing another child at this time.
I'm just curious, I'm not from the medical field. So is the teenage pregnancy definition of below 20, is that really exclusive? Because I think our viewers, everyone at home would like to know the line as to what is considered as teenage pregnancy.
Yes, actually that's the general definition. However, we we let our patients be seen not only by a pediatrician but also by an obstetrician at that time.
So in other words, it's teamwork. You know, when you have a teenage mom, you just don't, you need an obstetrician because the teen mom will have a baby, but at the same time, she's a pediatric patient. That's why you need a pediatrician. So you have the teamwork of a pediatrician and adolescent medical specialist and an obstetrician.
So that teamwork also includes the social worker, probably. Ma'am, we've invited you here today to also share, because we do know it's a teamwork. What role does the social worker come in?
Ang mga pasyente karaniwang nire-refer sa amin ng UB clinic for socio-economic evaluation at may kasama na rin doon na counseling. Hiwalay namin kinakausap ang nanay at ang teenage mom kasi magkakaiba naman ang kanilang mga concerns. Karaniwan na naming ginagawa na may counseling kami sa mga bata kasi marami silang mga psychosocial issues tulad ng nahinto sila sa pag-aaral, gaano ba sila kahanda bilang isang magulang para sa kanilang magiging anak, ano ba ang kanilang mga karanasan para maging tuntungan nila na sila magiging mabuting ina dahil sila man ay bata din at mag-aalaga pa sila na isang bata. So, paano nila pinaghahandaan at panibagong yugto ng buhay nila sa bagong karanasan bilang magulang. At may usapin din ito ng paano ginagabayan ng isang magulang, ang teenage mom na maging responsable na magulang para sa kanyang anak. Dahil siya bata din eh. So, sinasabi na lang namin sa mga magulang na dahil narito ng sitwasyon, kailangan nila ibigay ang paggabay, ang pag-encourage sa bata para daanan niya ng maayos ang bagong yugto na ito. At ina-encourage namin lagi sila na bumalik sa pag-aaral. Hindi magiging hadlang dapat ang pagkakaroon ng anak para hindi nila tuparin yung mga pangarap nila para sa sarili nila.
And may also add to that, it's important also sa kaso ng mga social worker is to prevent another teenage pregnancy because some of these patients, they come to us teenage pregnant and then they come back teenage pregnant again. So that is to prevent another episode of that and also teenage pregnancy also in their family.
So Ms. Badette, sabi mo nga, kinakausap mo ang magulang, kinakausap mo ang teen mom, hiwalay mo silang kinakausap. Kinakausap mo rin ba yung father ng baby?
Kalimitan kasi ma'am, hindi nila kasama yung mga tatay ng bata. Dahil may mga sitwasyon na ang teenage mom ay nakatira sa sarili niyang magulang at wala na silang komunikasyon doon sa tatay ni baby. Mas marami yung iba naman nagsasama na talaga sila. Minsan nagsasama na bago pa man nabuntis eh. So, tinatanong namin lagi, ano ang nag-udyok sa'yo para magsama na kayo? So, sinasabi naman nila, kasi mahal namin na isa't isa. So, sa kabila ng murang edad, nararamdaman nila yung pagmamahal na yon at pinapayagan na rin sila ng mga magulang dahil anumang pigil nila, hindi man nila mapag-iwalay talaga.
So Ms. Badette, matagal ka ng social worker sa PGH. Ilang taon na ba? 30 years. So sa 30 taong yon, ano bang masasabi mo, talagang tumaas ba ang numero ng teenage mom dito sa PGH?
Tumaas talaga, ma'am, at nakakabahala ang pagdami ng mga teenage mothers ngayon na sa paningin namin na dapat ang isang batang ito ay nasa eskwelahan na tinutupad ang mga pangarap pero nasadlak sila sa isang sitwasyon na kailangan na rin nilang harapin bagaman di sila handa talaga.
At that time din siguro, at this point, siguro maganda na rin tanong, ano po kaya ang tingin ninyo ang dahilan kung bakit tumataas nga itong teenage pregnancy? Kasi sabi nyo nga po na tumaas po. Ano kaya sa tingin ninyo ang mga dahilan?
Maraming dahilan, attorney eh. Nandiyan yung peer pressure, nandiyan yung access to social media kung saan ang lahat ng impormasyon ay nakabantad na sa iyo. Isang click lang ng kamay mo, may pwede mo na malaman na nangyayari sa buong mundo.
Sa amin naman, so in our point of view, there are so many different risk factors leading to teen pregnancy. So one strong risk factor is the lack of education regarding sex and reproductive health. Another is that they face barriers in accessing commodities and services. So ang mga matatandang buntis, pwede silang mag-access ng mga kondom, ng iba't ibang paraan ng family planning method. However, medyo limited ang mga teenagers natin. No? So kahit sana pag nag-start na sila o nag-initiate na ng sex, gusto natin marunong sila magprotekta ng sarili nila. Another barrier is that they have a lot of risky behaviors. So their emotions are intense, however their behaviors are still immature. There's actually the theory of the teen brain, wherein we thought that adolescents have mature brains during adolescence at around 18. However, it was shown in studies that the brain of an individual actually matures at around 20s. So we don't expect them to have good decision-making skills. Another factor is the family. So if the family has been permissive, meaning the mother or the father or a sibling is a teen parent, so mas mataas yung risk na maging teen parent sila, na sa isip nila na, ay, bakit si ate pwede? So siguro tanggap din nila mama at papa kung mangyari sa akin yon.
And we also notice in these patients, no, in these moms, that they have risky behavior nga, and they're delinquent, and they're juvenile delinquents, and there are problems with authority and social skills, communication skills early in life. So it's important that we address that early. So if we have identified girls like that, then we can at least start the counseling early to prevent teenage pregnancy.
Docs, kanina ko pa naririnig yung risky behavior. Pwede po ba pa-expound further kung ano ibig sabihin nito?
Risky behavior, ito yung gumagawa sila ng mga bagay na hindi maganda sa kanila. Katulad ng they smoke, they have multiple sexual partners. That's why they have an increased risk also for sexually transmitted illnesses. They use mga bawal na gamot. They also use that. And also, you know, the teenagers, they think that they're immune to danger. Yes. So they do dangerous things more easily. They're not that scared of diseases or dying, for example.
So actually, they think that they're invincible.
Yes.
No? Hindi ito mangyayari sa akin. Sa iba nangyari, pero sa akin hindi. So, okay lang, gagawin ko pa rin. No? And in terms of sexuality, the risky behaviors include having sex without protection at all, or meeting with someone they don't even know, but they do sex.
The problem with that, kasi sometimes is they cannot discuss this at home. So it's more of our culture also. It's hard for them to discuss sex with their parents. So they discuss them with their peers, and they get them from social media. And we do not know if they get the right information.
So napaka-importante ng communication sa bahay. Okay? And the ability to open up to your parents and talk about sex, no, instead of getting it from social media. Na-intrigue din ako doon sa teen brain, ano. I mean, it's really something that I learned today, na immature ang ating brain up until 20.
Yes, ma'am. Actually, mid-20s.
Hanggang mid-20s, Attorney Abdel.
Lampas 30 na ako.
So anong basis dito? I mean, is it a anatomical or is it physiologic?
Actually, several studies were done, and they had a series of MRIs from children up until 20s, and they saw that what's developing first is the emotions, and the prefrontal cortex, or the seat of judgment and good decision making, is the one that develops last, which explains the lag between the emotions as compared to good decision making.
That's really new to me. So, ang importante talaga ngayon, no, that we just don't look at the age or the number. We have to understand what's going on inside and the emotion in the brain. So you talked about the risky behavior and the increasing numbers. But then, can you tell us a little about the sexual activities of the adolescents now compared to before?
Well, according to the studies, they say that as much as 2 to 3 out of 10 teenage girls now already engage in sexual activity. What's the data that you have?
Here in the Philippines, the UP Population Institute did the study called the Young Adult Fertility and Sexuality Survey.
The YAFS survey.
The YAFS 2013. So the latest was in 2013, a little 4 years already. However, it was shown that a decade ago, so as early as 18 years old, they already engaged in sex. So that's 23% among adolescents. However, in the 2013 issue, it already showed that as high as 32% or almost a third already engaged in sexual activity. So that's really alarming for our nation.
But there's a gap between the early sexual activity and the access to healthcare as well as the access to contraception.
Yung sa access to contraception, curious lang ako, no? Kasi all over sa metro, meron kasi talaga mga 7-Eleven, mga mini-stop. And I see yung sa condoms and sa contraception, for example. I mean, hindi ako bumibili nun madalas. pero I have access. Parang, is this the same? Docs, are you saying na the same din po ba to? Kasi for me, pwede naman pumasok sila sa mga stores na ganito at bumili ng contraception.
Yes, they can, but because of their age, they fear that they're going to be judged. So, they don't usually go through that route. So, nangyayari, wala tuloy silang contraception.
Ang sabi nga nila, di ba, kapag bumili ka ng alcohol below 18, hiningan ka ng ID. So, ang issue ngayon, pag ikaw ay 14 years old at pumunta ka sa 7-Eleven, bumibili ka ng condom, they will be judged. That's the issue. Kaya may malaking issue tayo nga actually to condom access in schools. It's a big issue right now. So it is a concern, national concern.
Sa bagay nga, Doc, pag bumibili ako, I feel the judged. Judge ako ng mga ano.
Yes, and if you want to purchase, it's not something that you get immediately, like Mentos or any other candy. It's something that you should ask.
You should ask from the clerk, the store clerk. Ma'am, yung sa sexual activity po, yung sinabi po sa YAFS na survey po na yon, sama po ba na-validate po ba yan sa yung work ngayon sa a social worker sa PGH?
Bahagi rin kasi ng mga pagtatanong namin na kailan nagsimula ang kanilang mga sexual activities, saan nila to ginagawa at gaano kadalas. Kasi may mga kabataan na inaakala nila na kailangan maraming beses mo gawin para magbuntis ka. So, hindi nila na intindihan kung minsan na kahit minsan mo lang ito gawin, pwede ito magresulta sa pagbubuntis. At maraming bata na sa interview namin, karaniwan ito nangyayari sa bahay ng boyfriend habang walang ibang tao or sa bahay ng mga kaibigan. Yun ang mga ginagawa nila.
So lumalabas ba dito sa interview mo kung nag-attempt sila bumili ng condom?
Kalimitan, ma'am, talagang hindi nila naisip na gumamit ng condom. Kasi sa kanila kasi parang hindi kailangan. At tinatanong din namin, may pinagbantaan ka ba, tinakot, para may mangyari ito? So bago nangyari itong mga sexual contact, ano naging usapan niyo na gagawin niyo ba ito kasi gusto niyo o pinilit ka ba, tinakot, binantaan? So karamihan na nakausap namin talagang ginawa nila ito ng kusa at may pagsang-ayon talaga.
Okay, so nandiyan na yan, ano? So ang tanong ko sa inyo ngayon is what are we doing about this? How are we addressing a teenage pregnancy right now?
We have started in PGH the first structured teenage pregnancy clinic. So we call it the Teen Mom Clinic. So we started this as early as 2003. So this is a multidisciplinary thing. So once a patient comes in pregnant, less than 20 years old, they're referred to the high-risk clinic. And then in the high-risk clinic, we see them, we monitor their pregnancy, we take care of the mother and the baby, and then we refer them to the social worker for counseling, to the pediatrician to help us manage them because they're still pediatric patients. And then upon our history, if we elicit like this is a problem of violence or sexual abuse, then we also refer them to the child protection unit.
Gusto ko lang sundan yung word na they refer to the high-risk clinic. Sa isang ordinary na buntis, kapag sinabi mong high-risk, usually, mataas ang presyon, may diabetes, may sakit sa puso, mapupunta ka sa high-risk clinic, kaya ka napupunta sa perinatologist. Kasi ibig sabihin nun, yung nanay ay high-risk. Pero dito, ang naririnig natin, ang isang teenage mom is high risk. Kaya same category siya. Pero at this time, we have the Teen Mom Clinic naman.
Yeah. But we do not want them to feel that they're special, that they are, we don't want them to be stigmatized. So we see them in a very friendly environment, separate from the other high-risk pregnant women. Kasi we see a lot of hypertensive patients, twins, elderly gravidas, and everything in our high-risk pregnancy. These are, in this small group of women, we see them in another setting. Sa ibang lugar namin sila tinitingnan. Tapos, and then it's a friendly environment so that they can be encouraged to come back for prenatal.
How often is your teen mom clinic?
We have our teen mom clinic every Wednesday, but every day we accept referrals of new cases.
How many patients every Wednesday?
In our data, we saw 300 new cases each year for the last 3 years. At least for the last 3 years that I've reviewed.
Alam mo, Attorney Abdel, alam mo, nung ako ay estudyante, which is a long time ago, unheard of itong teenage mom. Okay, that's one. It's unheard of. Siguro towards the end of my residency, baka consultant nga ako na nagsimula na may mga maagang nagbubuntis. So, we really have, this is something that's evolving, we really have to address it. So, napakinggan natin kung anong nangyayari sa prenatal. Na-refer daw sa social worker for the counseling, and then na-refer sa pediatrician. So, anong role ng pediatrician ngayon? Dahil hindi pa naman lumalabas ang bata, Dr. Vanessa.
So, in the Teen Mom Clinic, we observe the adolescent-friendly health services, meaning we want, as mentioned by Dr. Valerie, we have it in a different place so they won't feel judged by older patients, no? Hindi sila parang mababastos o matatakot na mapagalitan. So, para lang silang classmates na pag pumunta po doon, ay meron muna silang health education module. So, there are 6 different modules. Merong care of the mother. So, they are taught proper nutrition, some exercise that would be allowed by their doctor, care of the baby or infant care wherein they will be taught, then afterwards they will do return demonstration on how to bathe the baby, paano ba maglagay ng diaper. Yeah, yes. So, paano ba magpaligo, magpalit ng damit. Another module is the breastfeeding module because of course we want them to exclusively breastfeed their babies. So, other modules include the physiology of pregnancy handled by the OB doctors, warning signs to look out for kung kailan ba mukhang manganganak na, ano ba yung kailangan bantayan po. And also on family planning because you want them to be able to access the commodities and services.
Docs, tanong ko lang yung sa module na yan, kasama din po ba dyan yung sa care for the self ng mother, no? Kasi teenage yan, so yung emotions niya very high, intense, ganon. Do they also suffer depression? Mga ganon. And who among the professionals here address it? The pedia ba? The social worker?
Actually, one of the services then is the psychosocial screening, no? So we do some interviews. It's just one-on-one between the doctor and the patient without the parents so that they could be free to really tell their issues, their conditions. And if we see that there's depression, we refer to psychiatry as needed, but all of them are referred also to our social worker. And if the adolescent, it seems that the adolescent has been abused, we refer them to the child protection unit. If they have other medical concerns, we refer them to other subspecialties like cardio or pulmo as needed.
Parang ang ganda ng teenage mom clinic na to. Curious lang, meron pa bang, or rather, how successful do you think this teenage mom clinic protects both the teenage mom and the child? Sa tingin po nito, I'm asking from a non-medical from a non-medical perspective.
Actually, our goal in this teen mom clinic would be to prevent a rapid repeat of pregnancy because they come into us already pregnant, no? So we address their issues, their medical concerns at that time. However, we encourage them to go back to school as mentioned by Ma'am Badette because if they're out of school, mas may risk na mabuntis ulit sila. And statistics show that yung rapid repeat of pregnancy happens in 19 months. So, nag-teen mom sila, in less than 2 years, andyan na naman sila, no? And we also encourage them to use family planning like condom, Implanon, or long-acting reversible contraceptives, no? Actually, in terms of long-term evaluation, it's still being done. So we cannot really say na 100% hindi na sila nabuntis ulit, pero at least we're giving them services that they don't have access before.
Yeah, medically speaking, compared to those in our admissions in PGH, compared to those who had no prenatal care, those who had prenatal care in our teen mom clinic end up with less stillbirths, small babies, preterm labor. So their outcome is better.
Ang sinasabi mo yung there are certain teen moms who did not have the benefit of the
Yes,
teen mom
many,
clinic.
many.
So they only come to the hospital just about to deliver.
Yes.
And you are getting better results
Yes.
when they have gone through the teen mom clinic. So on the average, can you give us some numbers? How many would end up to be stillbirths or small babies for those who do not go through the teen mom clinic?
I cannot separate the numbers now, but the number of patients who end up with stillbirth and neonatal death among our admissions in PGH is about 6%. 6%. And that 6% is for the general population. There are very few of them actually come from our teen mom clinic. Many of them have no prenatal outside. So, siguro roughly, I cannot say the exact number, but roughly it's more than twice probably.
So what's the reason for this? Kung bakit kailangan na yung preparation sa teen mom, what makes the pregnancy more successful?
Number one is the multidisciplinary approach. So we emphasize the care for themselves, the care for their babies, the importance of coming for prenatal care so that we can see that there are already complications developing. And if we need to deliver them earlier, we deliver them earlier, not when they come na stillbirth na yung baby, and not when they come with a small baby already because of lack of proper nutrition. So these are, actually some of them are very easy to address, like proper nutrition, but since they do not have that knowledge, they were not told that they should eat this food, they don't actually, and many of them, they don't take also vitamins.
Attorney Abdel, curious naman ako ngayon. So, nanganak na yung mother. I mean, can you describe, the feelings, the emotions of a mother upon the delivery of the baby? Sino ba makakasagot noon? Ikaw ba o kayong dalawa?
Both of us, yes, both of us. Of course, they're very happy, no? They're very happy that they have a successful pregnancy. Well, majority of them naman, they end up with a successful pregnancy. They're very happy. And in our setting, in our culture, every newborn is a gift, is a blessing for the family. So the whole family is happy. So at that point, parang all the problems that they have gone through during the pregnancy, sometimes they forget it already. Okay, during that point that the baby is out.
At that point po ba, meron pa po ba, pumapasok pa rin ba ma'am ang social worker pag lumabas na yung baby?
Yes, ma'am. Sir, kasi sa ward kasi, may mga social workers din kami. And these teen moms are still referred to the social workers for other needs. At kung may mga nakikita kami ibang problema, we also coordinate with the DSWD for home visit as needed. Kasi may mga ilang cases tayo na hindi basta ma-discharge ang mother at ang baby kasi may mga nakikita tayong ilang problema. So, kailangan namin makipag-ugnayan sa DSWD for their help kung anong assessment nila, risk and safety assessment kung may nakikita man.
So, does this clinic monitor after they leave the clinic?
Yes, we also do check up on them postpartum. Us and also the pediatrician. Now they have 2 patients already when they come back.
Actually, most of them prefer to have their follow-ups in the local health center kasi mahal po yung pamasahe, no? Pero we request them to at least come at least once postpartum para ma-check natin na nagpapa-breastfeed, kumusta siya pagkatapos manganak.
Of course, no, mas prefer natin na pumunta sila sa barangay health center kaysa hindi talaga pumunta po. It seems like ang ganda-ganda pala ng ginagawa ng itong teenage clinic na to. And this is the first time I've actually heard of it. So, do we know of other similar setup na clinics in other parts of the country?
Actually, we have one in Cebu, the Vicente Soto Memorial Hospital, and another one in Fabella.
So, are you involved in setting up these clinics, Dr. Vanessa?
Actually, the adolescent medicine section, or actually the Society of Adolescent Medicine, has been tapped by DOH so that this teen mom clinic will be duplicated in other areas to be able to provide the best service that we could give to our teen moms.
So, can you give us a little about the plans of the Department of Health with regards to teen mom clinic on a bigger scale?
Okay, so the Department of Health already has a nationwide campaign for the responsible parenthood and reproductive health law. So it aims to be able to provide these services to all the teen moms. Aside from that, there's also the program on training our different healthcare providers, maybe midwives or nurses or doctors, on how to handle them in an adolescent-friendly way.
Ang alam ko kasi konti lang ang adolescent medicine specialist, Dr. Vanessa.
Yes, ma'am.
Ilan ba kayo sa Pilipinas?
Around 25 po.
Wow, for 110 million, no?
Yes, ma'am.
110 million, kalahati doon ay under 20. So, what is your society doing in spreading this information? Kasi definitely hindi lahat makaka-access ng adolescent medicine specialist.
Yes, ma'am. So we are being tapped or requested by other hospitals also from the Visayas and the Mindanao, and also here in the far-flung areas in Luzon, to go there to visit them and help set up and guide them in setting up the clinic.
Okay, so can you tell us a little on how do we set up a teen mom clinic? Because right now, ang sabi mo nga, nagsisimula pa lang ang programa ng Department of Health with your help. Can you give us some ideas kung ano ba ang kailangan ng isang ospital para mag-set up ng isang teen mom clinic?
So actually, we teach them first what's the concept of an adolescent-friendly health service. No, ano ba yung mga pagiging non-judgmental, being respectful of them. No, tapos we teach them na sana yung room is adult-friendly, meaning may mga informational posters na nakapost na pwede nilang basahin. At sana yung schedule is not mixed with the younger kids, because it will be very awkward din kapag kunwari sa health center, merong teen mom, tapos ang katabi niya ay baby na umiiyak. So parang nakaka-disillusion for them to come back. No? And of course, we train the healthcare providers who will really handle these teens na mas maging sensitive and careful with their use of words.
So I'm sure may nakikinig sa atin, nanonood sa ating mga medical directors ng hospital. So aside from having the environment, anong advice nyo naman about the team? Anong team naman ang ating i-recommend sa ating mga medical directors?
There should be for the doctors, there should be the obstetrician, preferably the high-risk doctors such as us, the perinatologists or maternal fetal medicine specialists. And then there should be pediatricians, preferably also those who have specialized on adolescent pediatrics. And then we also work with psychiatrists, other internists, if they have other diseases such as heart diseases, for example. And then there should be the social worker. They're very important, the social worker, because we need to understand that our patient here is not only the patient herself, but also her family. Because sometimes, most of the time, there's a dysfunction also in the family that has produced this problem.
Tok, wala bang role dyan ng abogado?
Tatay nga sabi ko, kakausapin yung tatay. But I think, this has been very educational for us, and the message I'm getting is that every hospital should have a teen mom clinic.
Looks like it
yes.
po, no?
At hindi naman ganun kahirap pala, no? Making sure lang that you have a pediatrician, you have an obstetrician, a social worker to start with, and then identifying a room at the outpatient clinic to serve as a teen mom clinic.
Room and time.
So hindi bang pala ganun kahirap? Parang wala namang extra expense on the part of the hospital. Di ba? Tama lang ang intindi ko. Walang additional expense.
Yes, ma'am.
Yes,
Usually
yes.
the local hospitals also provide a pediatrician who could train from the section of adolescent medicine, who train with us as a fellow, so that she or he can come back and be the lead doctor
Okay.
there.
So in other words, advertisement yan. Meron kaming training for adolescent medicine sa PGH. We need more of them, around the country. Maybe we can ask them for a message, no, as we wrap up. Maybe a message from each of our guests.
Yeah, ma'am. Before we wrap up and finish our program for today.
So mahalagang maintindihan natin ng mga teenager na sila ay bata. So kailangan natin ibigay ang paggabay, ang encouragement at malaking bahagi ang ginagampanan ng pamilya dahil ang isang bata ay kailangan natin makita sa kabuuan, hindi lamang siya. So kailangan nating palakasin ang mga support system dahil ito ang magbibigay lakas sa isang teenager para harapin yung panibagong yugto ng buhay niya.
Yeah. Thank you so much, ma'am. Docs, kayo?
So, for me, our adolescents, especially the teen moms, need our guidance and understanding, not our judgment. No? So, we want them to have better lives, to move on later, while caring for their children and be responsible citizens.
For me naman, it is good that we give them access to information. But along with this, there should be also access to good health care and also to teach them how to be responsible young adults. This is what is very important to prevent teenage pregnancy.
So those are the keywords we're hearing. We have family support. We need a team in every hospital, and that we have to consider the teen mom, a high-risk pregnant woman, because there are many issues that have to be addressed. So ladies and gentlemen, I hope this episode has given you relevant information on how to address teenage pregnancies. We cannot close our eyes. They're here. They're here in the middle of life. So we have to make sure that we know how to help them as they go through their pregnancy. Thank you to our guests today for giving us the insights on the topic, and we appreciate the multidisciplinary approach on this concern.
And yes, that's true, Dr. Menchit. We'd also like to thank you for watching. We hope you have learned so much from today. I learned a lot. Kung ako na nga na hindi nga from the medical field, ay maraming natutunan yung teen brain, ganyan, yung risky behavior. I think naman kayo rin marami kayong naipulot. We hope you will watch other episodes of Kalusugan ay Karapatan. Thank you and good day.